Hey guys, this is Andrew Lee, your health insurance guy and CEO also of Health Mutual Network. And I have a pretty cool video for you guys today. I'm going to go over the pros and the cons of Medicare Advantage. Now, Medicare Advantage could be sometimes a controversial topic. You guys have seen the commercials on TV with all the retired football players and the continuous spamming of Medicare this, Medicare that. Now, most of those commercials and all, especially all the mail that you get and all the phone calls are generally about Medicare Advantage. So I just wanted to go over the pros and cons for the people out there, just so that you're educated on how this all works and if this is going to be a good fit for you or not. Now, let me start with this. Medicare Advantage is a type of Medicare health plan that's offered by private insurance companies that contract with CMS, so the Centers for Medicare and Medicaid, to provide healthcare services to Medicare beneficiaries. So, those are going to be people that are seniors or for people that are on disability or ESRD that qualify for Medicare. And here's some pros and cons. Again, you guys already have your Medicare A and B to have you get set up for Part C, which is Medicare Advantage. And this specific type of plan, they generally will call this a an all-in-one, a Medicare health plan. If anything like that is going to be a Medicare Advantage plan because it just has everything all in one. So one of the benefits, one of the pros are it gives you additional benefits outside of original Medicare. Of course, original Medicare is lacking in certain areas, such as the 20% that's left behind by Medicare's Part A and B, which is hospital and doctors. So you're left with the rest of the 20%. On top of that, you're not offered dental, vision, hearing, or any ancilleries. So, many Medicare Advantage plans will offer benefits that aren't covered by original Medicare. Such as all of the features that I just named, and sometimes they'll have some other benefits like flex cards and things like that, Part B gift back. So that's the first pro. Number two, I would say is there's generally lower out of pocket costs. I mean, depending on where you're at and what kind of, if you're more in a more metropolitan area, these Medicare Advantage plans are pretty competitive with each other, especially every year. So they always try to one up each other by having a lower out of pocket maximum. I think competition is great for the Medicare Advantage industry, or at the very least, the sector of Medicare Advantage when it comes to Medicare. I think competition is really good because now all these carriers and these plans are trying to compete with each other and just trying to be better, so it's a better customer experience. So that of course, clients will go with that carrier. So I do like that for beneficiaries. And of course, again, so copays are going to be pretty low. You're going to see a lot of $0 across the board for doctor visits, for specialist visits, for your deductible, for mental behavioral services, all the way down to you know pretty much everything except for medication is going to be at a pretty low cost, at the very least in my area as well too. So just depending on where you're at, it could be a very good fit for you because of the out of pocket costs. They're going to be pretty low. Also, they do provide more of a comprehensive coverage. So Medicare Advantage plans, they could offer more comprehensive coverage, including medication. So Part D, which is already included in the Medicare Advantage, it's already there. So you're not worrying about having to find a Part D standalone plan with your current policy. It's already going to be embedded, and sometimes you know with these plans, the medications on Medicare Advantage, I mean, you'd want to really compare it to with the prescription drug plans and also Medicare Advantage. Sometimes in certain areas, the Medicare Advantage could have lower drug costs than the actual prescription drug plan. So that's just one thing to be cognizant about. And I would say number four is the network of providers that Medicare Advantage has. So often they're going to be grouped in medical groups, right? Often the doctors that are in network are going to be part of a medical group. Sometimes they can be part of several, but of course you want to go with the one that's going to be aligned with all your doctors. So it does have a network of providers that can make it easier for you to just find a doctor or hospital that accepts the plan. You also do get additional support with Medicare Advantage plans, you will get, fitness programs, disease management programs, health coaching, things like that. So those are some extra throw-ons for a Medicare Advantage plan. And also, of course, the potential for lower premiums. Generally, they could even be $0 per month as long as you're paying for your Part B. And sometimes there's Part B give back plans. So sometimes you can have your Part B covered if you're paying out of pocket for that. So those are the pros, I would say, for Medicare Advantage. For the cons of Medicare Advantage, again, there's going to be two camps: the people who are team Medicare Advantage. This is what I want, Andrew. I'm healthy. I go to two doctors and I take two generic medications. Okay, let's try to take a look at some Medicare Advantage plans. Now, if people are, I mean, there's just a lot of information and misinformation out there about who's eligible for Medicare Advantage. What does it do for you? What are mostly they talk about the cons, right? A lot of people are going to always say, especially people who not so much the people who just turned 65, but people who have been in the Medicare system, they're going to preach Medicare supplements. Medicare supplements, again, is a paid type of plan where you're allowed to go wherever you want, but you just need to get an additional Part D plan. And also, you need to cover your ancillaries by yourself. So, dental, vision, and hearing, that's another separate charge, right? So, you sort of have to just pick and choose wherever you want to go. But some people swear by that and think that Medicare Advantage is the devil. And here are some reasons why. Again, I'm not partial to either. I just wanted to make an objective video about why people are saying these things about said plan. So the number one thing that people will have an issue with is the limited provider network sometimes. So if, again, like I mentioned, it is a pro and a con. So if your doctor happens to be in one medical group, but you have a specialist in a totally different medical group, and it's life or death, that you do have to go to that specialist, then they have to align in the same medical group. If they don't, you got to switch to a plan that does have both of them in network. Sometimes they both might not be in network, so you might have to compromise on what type of plan that you want, or maybe even go with a Medicare supplement at that time, right? But if it really comes down to that. But if some people are in a situation where they don't go enough to the doctors, or they don't have enough doctors to really justify paying for a premium when it comes to a Medicare supplement. So those are people that are considered Medicare Advantage plans. But again, it could have a limited network of providers, which makes it sometimes difficult for doctors and hospitals to accept that plan. The number two reason I would say is there's some restrictions on services. So Medicare Advantage plans, they could require prior authorizations before surgeries and treatments. If you guys have been in sort of the HMO kind of system, when you guys were under 65, you guys know what I'm talking about. You guys would have to get, let the doctor know, get some kind of prior authorization before a surgery comes up. So that's the same case with these plans. Most of the times, they could, in certain areas, have higher premiums than original Medicare does. Now, I'm talking in certain areas. So in certain areas, it can work really well and have a really low out-of-pocket maximum. And in certain areas, there won't be any networks that are available, and sometimes the premium itself, again, there could be a premium tied to Medicare Advantage, could be high, just depending on your area. So again, this is not a one size fits all for both sides, for both Medicare supplements and Medicare Advantage. So I just wanted to break down both sides. Now, sometimes there is limited flexibility with Medicare Advantage plans. So sometimes they won't allow for too much flexibility. Again, if you're out of the medical group, which sometimes can be, frustrating, just having some limitations. So again, that could be, one another factor as to why people might consider a supplement, or just staying on original Medicare. So sometimes there could be a surprise in billing. If for any reason Medicare Advantage plans did not cover a certain service, which sometimes they wouldn't cover if it's like out of network, or whatever the case is. It can sometimes be a surprise bill. So sometimes we got to watch out for that, right? With the Medicare supplement, sometimes if you just, let's say you have a plan G, all you have to do is pay your deductible, and that's it, except for medication and ancillaries. So sometimes there could be a surprise for billing, but just reach out to an agent like me so that you can go over everything about your policy so that there are no surprises. And it's, of course, free to work with us. Sometimes the Medicare Advantage, and this is number six, sometimes the complexity of Medicare Advantage plans can sometimes confuse beneficiaries because there's so many plans available, especially one carrier could have multiple plans. It could be a little bit overwhelming, but of course, with you reaching out to a Medicare agent, I mean, we're here to sort of break all that down and then just give you the background information on the carriers themselves, the plan themselves. That's basically what we're here for. Also, this is a big one. There could be potential changes in your coverage. So this is number seven. There could be potential changes in coverage where Medicare Advantage plans can change their coverage benefits from your out-of-pocket maximum being X amount, let's call it 299 to all of a sudden 699, right? And this is a reason why you should always review your plan during AEP, which is October to December. Again, if you don't have an agent, reach out to me. My direct dial is 323-844-8471. I'll put that on the bottom. But during AEP, I highly, highly would recommend, especially if you're on Medicare Advantage, reviewing your policy because it could change the next year. And also, there could be other plans that your doctors are in network with that have more benefits. Again, they're very competitive with each other. And I would say last, there are potential for penalties. So beneficiaries who enroll into Medicare and then switch to original Medicare, they sometimes could face penalties for not having continuous coverage because, of course, you need to keep your Part B in order for you not to have that penalty accrue every month. So just those are just sort of the breakdowns. That's the essential breakdowns of carefully evaluating your Medicare Advantage options. Again, it works great for a lot of people, and some people it's just not a good fit, right? So hopefully this video will help with breaking down both sides of what they do. Again, if you're again, your doctors are in network, you're pretty healthy. Hey, Andrew, I just don't want to justify paying 300, 200 extra bucks per month for something that I'm not really going to use all too much. Then maybe you're a good fit for that. But of course, everybody's built different. Everybody has different needs. Please reach out to me at 323-844-8471, or you can email me directly, Andrew@healthmutualnetwork.com, and then I'd be happy to first do a needs analysis just to see what you're actually needing, what your situation is, and then from there I can just sort of navigate. Okay, are you a good fit for Medicare Advantage, Medicare Supplement? If you're a good fit for Medicare Advantage, then I break this down for you and then some, and then go over your policy with you. So feel free to give me a call if you do need assistance, and hopefully you have a good rest of your day.